morning, Dr. Lai, Zhang Tie, and fellow classmates. As we all have learned so many interesting facts and information about the healthcare service in Shanghai, like life expectancy, infant mortality rate, private and public hospitals, and many more. From Dr. Lai for the past 2 weeks, I suppose you all are eager to know how healthcare service in Shanghai will be compared to other countries as well. Students from our class are from different parts of the world, and it's truly wonderful to explore further about the healthcare service in their countries. So today I will introduce to you the healthcare service of middle-sized countries in Southeast Asia, and also is where I come from, Thailand. However, in this presentation, we'll focus mainly on the medical insurance system. In this presentation, there will be two presenters, Lim Wei Qi from Singapore and I, Jaylyn from Thailand. Our group members who have worked together on these projects are Laraine from mainland China and Teng Jin Leon from Singapore. So, without further ado, let's get started. Our presentation will be broken down into 4 parts. The first one, overview of Thailand's healthcare. The second one, Bangkok's medical insurance system. The third one, Shanghai medical insurance system. And the last one is the comparison of medical system between 2 cities. Now, let's start with the overview of Thailand's healthcare system. But first, I want to ask, what are the things you know about Thailand's healthcare system? Have you ever heard about it from TV news or from social networks feeds? Please keep your answers in mind and compare it along to the statistics of Shanghai we learned in class. We start off with some medical statistics. Please note that a city level of data is not available, so we go on by using Thailand and Shanghai. First, life expectancy, infant mortality rate, maternal mortality rate, total number of hospital beds, the number of medical professionals. All of this is compared using the same units between the 2 cities. As you can see from these statistics, Shanghai has a better score in every aspect. Shanghai has higher life expectancy while lower infant mortality rate. When talking about healthcare service in Thailand, it all comes to me that Thailand has the largest healthcare hospital chain known as BDMS, which stands for Bangkok Dusit Medical Service. It has 49 big-sized hospitals. It is also the largest private hospital group in Thailand and a top 5 private hospital groups globally. In my opinion, BDMS medical fee is quite expensive for Thai people, so it mostly provides medical service to international patients, and it promotes a lot of advertisement in foreign TV channels to attract foreign patients. As you can see from the pictures here on the right side, BDMS has expanded its hospital to all of the regions in Thailand, hoping to become the #1 hospital chain in Thailand, competing with its competitor Bamrungrad Hospital. Next, after getting an overview of Thailand's healthcare, now it's time for our main focus of presentation, which is the medical insurance system. In Thailand, there are mainly the following 3 types of medical insurance, and the overall medical insurance coverage has reached 95%. First, we look at the first category. This insurance is for the vulnerable population, including farmers, unemployed, and the elderly, accounting for 75% of the populations. Patients can take the golden card to public hospital for medical treatment, and the treatment is super cheap. It's about 30 Thai baht or about 6 renminbi. The second category, which is the labor insurance, also known as Social Security Fund, which is compulsory insurance. Patients can go to the hospital contracted with the company, including public and private hospitals. For the third category is the civil servants medical benefit. This has been running for more than 50 years, covering a population of about 5 million civil servants, and each person enjoys the highest medical expenses among the 3 types of insurance. Also, did you know that Thailand Happiness Index ranked first in the world, and the lower medical costs may be one of the important sources of happiness for Thai citizens? For the next slide, we will look further to this pie chart, which shows that the Thai government's medical expenditure in 2012 was about 11.3 billion US dollars, which account for 75% of the total medical expenditure. And the private medical expenditure was about 3.8 billion US dollars, totaling approximately to 15.1 billion US dollars. The government's medical expenditure was about 3 times that of the private medical expenditure. For the next slide, I would like to introduce to you the 4 main medical insurance companies in Thailand. And for some reasons, they all use blue for their logos. Anyway, the first one is Muang Thai Life Insurance or Muang Thai Prakan Chivit. Maximum coverage per year is 500,000 Thai baht. The second on the top right is Sin Mankong Insurance with also 500 Thai baht maximum coverage. The third one is Viriya Insurance and the last one is Tipaya Insurance. All these companies provide medical insurance for Thai people to choose for. And for my family, we all use Muang Thai Life Insurance Company. So it's getting more fun to know about Thailand's healthcare system, right? But this is just half of the presentation. We will have Lim Wei Qi to continue to explore further about Shanghai's medical insurance system. And then she will explain the comparison between Thailand and Shanghai. And now I will pass the microphone to Lim Wei Qi. Bye bye!
Thank you, Jaylyn, for introducing Thailand's healthcare system in such great depth. That was a fantastic insight. I am Lim Wei Qi from Singapore, and I will now guide you through the medical insurance system in Shanghai. Shanghai medical insurance is divided into 3 different types. Firstly, the basic medical insurance for urban employees. This is included in the 5 types of insurance paid by the employers. Secondly, the basic medical insurance for urban residents. The insured people are mainly citizens under the age of 18 and unemployed people over the age of 18. Thirdly, the new rural cooperative medical system. This medical insurance is for farmers with rural household registration. All of these are helped by the Shanghai Human Resources and Social Security Bureau. In regards to the average insurance participation in China, the National Health Commission recently released their 6th National Survey Report on Health Services. The report shows that the coverage rate of basic medical insurance has reached 96.8% and the participation rate of basic medical insurance for residents in urban and rural areas is 96.1% and 97.6% respectively. It should be noted that in terms of medical insurance coverage in Shanghai, there are no specific statistics on medical insurance coverage of local residents. It could be inferred that this figure should not be lower than the national average shown in this slide because Shanghai is a first-tier city. However, this then brings us to a new issue. As an international metropolis, Shanghai has a large number of migrant and foreign workers. Seeking medical treatment or paying medical insurance in different places may be a main problem faced by Shanghai's public health system in the field of medical insurance. Scholars from Huangpu District Health Examination Station and the School of Public Health of Shanghai Jiao Tong University have conducted a separate survey. The result shows that the basic medical insurance coverage of migrant workers in Shanghai was only 35% in 2017. If migrant workers temporarily lost their jobs and did not pay for the other 2 medical insurance in their registered residence, they would not be able to enjoy any medical insurance coverage. Therefore, it can be inferred that the medical coverage is not as accommodating to foreign workers. In contrast, we believe that Thailand's universal coverage plan for unemployed and other disadvantaged groups, as what Jaylyn mentioned before, may instead guarantee people's ability to receive medical treatment more broadly as compared to Shanghai. According to the data seen in this slide, both China and Thailand have achieved high levels of medical insurance coverage, with China marginally ahead. But China's medical insurance reimbursement amount lags behind Thailand's. Medical insurance expenditure in China amounts for around 7%, which is significantly below the global average of 10% to 12%. For the whole of China, it may take a long time to raise the amount of medical reimbursement. For Shanghai alone, although there are no publicly revealed financial expenditure figures or reimbursement rates, the city has been attempting to alter the scope of medical reimbursed drugs and medical services, according to the information disclosed by the Shanghai Medical Security Bureau. We believe that Shanghai, as an economic developed first-tier city with extensive medical services, will be able to increase medical insurance utilization, gradually propelling other cities and regions to do the same. Now it's time to take a dialectical view at the proportion of medical insurance reinvestment in relation to the current issues of both regions. Firstly, although the high medical insurance reinvestment rate helps to elevate some of the burden on residents, Thailand's excessive medical insurance expenditure has placed a significant strain on national finances. The government has now announced plans to modify and lower the reinvestment proportion in the recent years. Secondly and thirdly, due to the low cost of diagnosis and treatments, as well as Thailand's large population of insured patients, public hospitals have now become congested. Which then leads me to my last and final point, that the public hospital quality of medical care and service is considerably lower to that of private hospitals. However, among the top 50 hospitals in Thailand, only one is a private hospital and the rest is public hospitals. Furthermore, due to the early development of Thailand's private medical industry, the tourism medical industry is also very developed, with approximately 1.1 million foreign patients treated each year, making domestic medical resources more unbalanced and making it more difficult for vulnerable groups to enjoy better diagnosis and treatment quality. This suggests that both public and private hospitals are extremely crowded and may be unable to accommodate to both citizens and tourists. There are two major issues with Shanghai's medical insurance reinvestment. To begin with, as highlighted in the previous slides, the scope of reinvestment is limited and the utilization rate of medical insurance is low. Second, the proportion of migrant workers who pay for medical insurance is small. They do not enjoy as much medical coverage. Before we summarize what we have learned throughout this entire presentation, let's go through the pros and cons of a high-level medical insurance system. For the benefits, we can deduce that such a system will aid in lowering residents' medical expenses and increasing citizens' happiness index. Furthermore, it will reduce the likelihood of illness-related poverty. In terms of drawbacks, such a system will put more financial strain on the government. Second, it may increase the difference between public and private hospital diagnostic and treatment experiences, resulting in an imbalance in quality resources so on and forth. Both of these occurrences were identical to what had happened in Thailand's healthcare system. To conclude this presentation, our group has made a few proposals based on the comparison of the two regions. To begin, the reimbursement rate of medical insurance should be determined by the population size and the financial situations of that region. Second, governments should be mindful of the significant disparities in diagnosis and treatment between public and private institutions that are created by medical reimbursement. Third, one of the keys to improving people's basic medical quality and satisfaction in Shanghai is the steady and planned development of medical insurance coverage of medications and services. Thank you so much for listening. We hope that our presentation provided you with fresh ideas and insights. This presentation was made possible by our lovely Professor Lai, TA Sam, Jaylyn, Laraine, Jin Leon, and myself. Our group members would like to thank you once more for this fantastic summer course.